This segment of Delmarva Live is brought to you by Delmarva Dental Services.
If we were to come up with the #1 question most people ask at the dentist's office, it would probably be pretty simple. Do I have a cavity, right?
That'd be the one you'd ask. Okay, well, today we're going to challenge you to take that pressing question to the next level. With us this afternoon is Dr. Lee Auke with Delmarva Dental Services, here to share with us the top questions you should ask your dentist. Thank you so much for joining us.
Thanks for having me.
Have you. Yeah. Okay, now here's what we're going to do. We're going to go over the top 5, and we're going to put the other 5 online at delmarvalife.com so you'll be able to find them there. Okay, so we're going to start with number 5. Why is it so important for me to have x-rays taken, and how often should I have them?
So when we are looking at x-rays, we are not just looking for cavities. That's the #1 question, right? People want to know, do I have a cavity? But that's not all we're actually looking for. We can see a lot with our x-rays, especially with the new advances in digital radiology and 3D scans and things like that. Right. So we can actually diagnose cysts or tumors or, and hopefully that's not what we're finding, but we are able to look for that. So sometimes we say, wait a minute, there's something else going on here more than meets the eye, and it may not be something you feel or knew was happening. We can also track changes in your gum health and bone health over time. So we like to have a series of x-rays that we can compare and say, wait, you're getting older, our mouths change too, just like the rest of our bodies, and we need to change what we're doing for you at this point.
Right. Okay, so x-rays are really important.
Yes.
All right, number 4, I have dental anxiety. Is there anything that can be done to help me relax during appointments?
Absolutely. So at Delmarva Dental Services, we actually use what we call the Cora's Anxiety Questionnaire, and it helps us to determine what about the dental visit makes you anxious. It's different for everyone. Sometimes it's the sounds, sometimes it's have to get numb, sometimes it's I don't like the smell or the taste of something, or I don't think I can keep my mouth open long enough. There are a lot of different things, and so by asking those questions we can help to figure out how do we help you. Sometimes it's not even a matter of needing sedation. Maybe it's headphones that will help you drown out the sound. Maybe it's watching TV just so you have something else to focus on. And then we do also offer options such as nitrous oxide, Valium, or another oral sedation if we do find, in fact, that you do need some more help to kind of get you through the appointment so that you can get the appropriate care.
There are options.
There are options.
There are options. Okay. All right, number 3. I have taken an antibiotic for a dental infection and my tooth feels better. Do I still need treatment?
Really common question. So the reason that you had a toothache is there's something wrong with the tooth. It's broken, it has a cavity, it's been swollen. So taking the antibiotic may help treat part of that issue. It's treating it systemically and reducing some of the inflammation and the discomfort, treating the bacterial problem. But if the tooth is still there and it's untreated, the source of the problem is still present and you haven't actually done anything to fix that. So the downside of doing that is, yeah, it buys you a little bit of time, maybe makes it feel better until you get treatment done, but if you don't do the treatment, it'll come back and it'll come back worse.
Right,
Yeah.
I did not know that. Okay, number 2, when should I bring in my child for their first dental appointment?
So we actually would like to see children come in once they start getting their first tooth, just to get them the idea of being at the dental office. Maybe come in when mom or dad comes in, sister or brother comes in, so they have an idea that this isn't a scary thing. We like to take their picture and have them smile. We can put it up on a monitor. They can see how they look at the dental office. Maybe just add a little bit each time, kind of like touch their face or have them look in the mirror, that sort of thing, just to get used to it. But we also like to go over with mom and dad diet habits, what to do as far as starting to introduce a toothbrush or when to start introducing a little floss, that sort of thing, so that you get your kids in the right routines from an early age.
So start early.
Early. Start
early. Okay. #1 question to ask your dentist so that you are in the know. Why do I need a comprehensive exam before I can get a cleaning?
We know at Delmarva Dental Services from our experience that all patients are unique, and this means your mouth too. So we want to get to know our patients, talk to them about their medical history, their past dental history, their diet habits. How do you brush and floss currently? Or do you have dry mouth? Are there any concerns that you have? So we find that if we get to talk to patients about all of these things, then we can more appropriately say, here's what I think we should do in your situation. Nobody is the same, and again, that does mean your mouth too. So we like to go over that. We want to make sure all of our patients are receiving the appropriate type of cleaning. Gum disease can be genetic. It can be due to lack of routine appointments. It can be induced even by medications or other systemic conditions. So, you know, we just find that it's really important that patients are aware and educated on what they need to know.
Yeah.
Yeah.
Well, there you go. And you've got 5 more questions that are just as fascinating as these. You'll find those on delmarvalife.com. All you have to do is click on what's happening today. Dr. Liaki with Delmarva Dental Services, thank you so much for joining us.
Thank you.
It was wonderful having you.
Yeah.